And hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. So today is day 4 of Mastering Diabetes.
Hi everybody, I'm Chef
AJ. My guest is
March
Kylie Buckner.
22nd,
She is an RN, and she is one of the coaches for Mastering Diabetes, and we're going to learn so many things about how this is so important to women. So even if you're not a woman, you still need to watch because you probably have a mother or a sister or a wife or a daughter, and insulin resistance can affect people at all ages of their life. So please welcome Kylie Buckner to the show. Actually, no, I'm not going to welcome her right now. We're welcoming Cyrus Kambata, who's going to introduce her. I got so excited to get to the guest, I forgot to introduce my.
Yeah, you're like, who needs that guy? Who forget that guy? Yeah, I'm not going to steal the show here because truly Kylie is the star of today's show. There's no question about it. So just like Chef AJ was mentioning, what Kylie is going to be talking about today is everything you ever wanted to know about the intersection of plant-based nutrition and women's health. Okay, so it's like you have plant-based nutrition, which we talk about a lot in Mastering Diabetes. Chef AJ talks a lot about it, and many of the plant-based doctors who come on the show also talk about it. And then in addition to that, you have like the very specific collection of issues that affect women in particular. And those collections of issues include things like polycystic ovarian syndrome, otherwise known as PCOS, gestational diabetes, and menopause. Okay, so those are sort of like 3 particular conditions that Kylie is an expert on. And then in addition to that, Kylie herself is undergoing a plant-based pregnancy. Okay, so Kylie is now we're 6 months plus pregnant, and she's been eating a plant-based diet, for over 10 years at this point. And so there isn't a single piece of food that's gone into Kylie's mouth that isn't 100% plant-based, and we're going to continue that. And we're also going to plan on feeding our baby 100% plant-based from the minute that baby is born. And so Kylie has a wealth of knowledge about like her own personal experience and also the benefits of eating a plant-based diet during pregnancy and after pregnancy to mitigate many of the conditions that often can affect women during pregnancy and beyond. So point being is that, I have the pleasure of, calling Kylie my wife. She's brilliant. She's wonderful. She's beautiful. She has a lot of information. And just like Chef AJ said, if you yourself are not female, not a big deal. Please share this information with anybody who is female that you think could benefit from it. And if you are female, listen up because she's an encyclopedia. And I think you're about to get your socks knocked off. Kylie, it's all you.
Woo. Well, thank you. And thank you so much for the introduction. And Chef AJ, thank you so much for having me today and for having Mastering Diabetes here this week. As Cyrus mentioned, we work together every day, and as his wife and, our family we love what we do with Mastering Diabetes, and we're so proud to be able to be here and talk about this week. So thank you.
I'm so excited to hear your story of how and why you became plant-based 10 years ago and what actually you do for Mastering Diabetes. One of the things I forgot to ask, does somebody have to be like at least 18 to be in your group? Because I'm wondering if there's young people that are having these problems with diabetes.
Yeah, absolutely. So we actually do work with many children and their families. We work with a lot of kids who have type 1 diabetes as well. And we help them adopt a whole food plant-based diet and even adopt the principles of the Mastering Diabetes method to keep their insulin sensitivity as high as possible so that they have their best outcomes in their diabetes health. So we actually work with a lot of families with kids with type 1 diabetes as well. And it's amazing to see how responsive children's bodies are to whole food nutrition. Their diabetes health improves significantly and very quickly. So kids are quite resilient.
That's so interesting because I remember I'm in my 60s and I remember my grandmother had diabetes and it was just called diabetes. And then when kids had it, it was called juvenile diabetes. But now it seems like kids are, in addition to getting type 1, they're getting type 2.
Absolutely. There's a huge increase in the number of kids that are living with insulin resistance. And, as Cyrus explained earlier this week, what insulin resistance is, obviously, the more saturated fat that kids are getting in their diet, they're developing insulin resistance. They're developing conditions like cardiovascular disease and type 2 diabetes at younger and younger ages. And it's very concerning from a population, if you look at the population of our overall health as a population, it's quite alarming, and it's preventable for children being diagnosed early on with type 2 diabetes. That's very preventable. And whole food nutrition is a really great way to prevent that from happening.
Are children that are being diagnosed with diabetes being treated the same way as adults? I mean, when Robbie told his story, it was like, just take your insulin and eat what you want. Or are they making kids go low carb the way they tell adults to do?
Same strategy, same nutrition strategy. So when there is a difference between type 1 and type 2 diabetes diagnosis in children. So, the term juvenile diabetes is now, just generally type 1 diabetes. And that's, like Robbie was diagnosed when he was an adolescent. And most kids there's a lot of children that are diagnosed even younger, as young as 1 or even younger. And that's an autoimmune, that's the autoimmune form of type 1 diabetes. But those kids are yes, the recommendation is still the same as adults. It's a low carb, very low in carbohydrate, higher in protein, higher in fat. And that's exactly what kids are being prescribed.
That's just crazy. Didn't any of those people read this book?
Well, the good news is that when they do, I'm the beauty of our coaching program is that we do work with many families that are going through this exact situation where they're getting information from their physicians, they're reading our book, they're reading about whole food nutrition and wanting to keep their families as healthy as possible, especially with parenting. Plant-based parenting is a whole other topic that is so exciting, and it's something that Cyrus and I are starting to really navigate and look into as we're learning more about becoming parents and becoming plant-based parents. But there's so many great resources out there for parents to learn more about the benefits of creating a foundation for your child to have their best health in the long term. And creating these habits now is so important. And so, but there's a lot of conflict in like our messaging versus what people are hearing from their doctor and their endocrinologist and their pediatrician. So there's a lot of conflict there for sure.
Did you have any resistance to having a plant-based pregnancy from your pediatrician or obstetrician, whoever you're seeing?
Yeah, so I'm actually seeing a midwife, and no, she's been super supportive, really on point. Like I've shared with her like my nutrition strategy, and I went very armed and very prepared with kind of anticipating that there might be some questions, but she was actually really supportive. She was excited. She felt it was, everything about this pregnancy has been super healthy, and the baby's growing really well. I'm on target with everything. So it hasn't been a concern at all. And she's been really supportive.
Nice. Are you having a home birth?
No, not a home birth, but it is midwife and doula supported. And because it has to do with kind of where we live and just getting the ideal support. And actually kind of goes into my background a little bit. I was a NICU nurse for many years, and there's a little something about being having that background and that experience of NICU nursing that I do feel really well supported in a hospital. So we're going to use a local hospital, but midwife and doula supported, which is, we're aiming for a natural childbirth. That's our plan right now.
That's going to be great. Well, I can't wait till the kid's old enough to learn how to make a Cyrus salad.
I know. Cyrus can't wait either.
Cyrus salad. I don't even know how to make that. What is that? That sounds tasty.
Cyrus made one on the Truth About Weight Loss Summit. Everybody loved that recipe. Well, first of all, the kid has to have teeth before he can eat the Cyrus salad. So
absolutely.
That would not be great. What do you do specifically at Mastering Diabetes, Kylie? Do you coach people individually? Is it in small groups? How would one work with you?
So yeah, I do all of those things. I work individually with private clients. I work with a range of people, my youngest client right now is 5, and we work with people throughout their lifespan, but we do one-on-one individual personalized coaching and also small group coaching. And in those settings, we help people move through our program and take step-by-step approach to reversing insulin resistance and getting their best health outcomes. And usually it has to do with managing blood glucose values, learning how to strategize insulin dosing, learning how to talk with their physician or their healthcare provider, especially when it comes to like managing medications, reducing medications. And one area that I'm really, really passionate about is working with women and women's health topics. And we actually just launched a gestational diabetes program, and that's been really exciting because it's something that is very close to my heart as I'm navigating pregnancy, but also because of my background in women's health nursing and NICU nursing. I spent a lot of time in OB-GYN nursing. So, it's just something that I'm very familiar with and also very passionate about, helping women get their best health outcomes during pregnancy. So there's lots of different ways to work together.
In case somebody doesn't know what is gestational diabetes, and how do the things you teach help somebody either not get it in the first place or mitigate it once they have it?
Yeah, great question. So gestational diabetes is a form of diabetes that is diagnosed during pregnancy. And typically it's diagnosed between usually around 24 to 28 weeks of pregnancy. And so you're in your 5th to 6th, maybe heading into your 7th month of pregnancy. It's an interesting condition to be diagnosed with, because women who are diagnosed with gestational diabetes often are, first of all, they're at much higher risk in the future of developing type 2 diabetes. It also can lead to complications during childbirth. It can lead to some challenges for their unborn baby. And so mitigating blood, like you were saying, like how do you mitigate the risk? Lowering blood glucose and keeping blood glucose in range during pregnancy is really, really important. The challenge with glucose testing is that there's an entire, up until your 25th or 28th week, most women aren't being tested for their blood glucose up until that point. And so a lot of times when women are first diagnosed with gestational diabetes, it can be pretty significant at that point. Blood glucose levels can be very high. And so there's often a very aggressive treatment plan because there isn't any sort of progression of testing for gestational diabetes along the pregnancy. So that's a little bit of a challenge. And a lot of women who are living with insulin resistance prior to pregnancy, those are the people who are going to be at your higher risk for developing gestational diabetes. So if your blood glucose is elevated prior to pregnancy, if you're not at your ideal weight, if you have high blood pressure, high cholesterol, all of those factors, those risk factors for insulin resistance are all markers for potentially developing gestational diabetes. So ideally, when we talk about preventing gestational diabetes, we're working on understanding those biomarkers prior to pregnancy and actually getting everything into range, especially when it comes to achieving your ideal weight. The best time to do that is prior to pregnancy or early on in pregnancy to minimize your risk for developing gestational.
Yeah, or before you get pregnant, maybe even.
Absolutely. Yeah.
So when did you go plant-based? 10 years ago? And was there a reason? Were you with Cyrus then? Was he the impetus?
No, it was actually before I met Cyrus. And I was actually, it was 2011. I was going through some really big life changes at that point. And my friends actually were exploring a plant-based diet, and they had read the book, The China Study. And they handed me the book. They're like, hey, we're trying on this plant-based diet, and like we're doing it for our health. And they read the China Study, and I read the book. And I remember reading it and just thinking, why was I never taught any of this information, like about low protein and low animal protein and how it benefits your long-term health, and these chronic health conditions can be avoided. And I just felt like this book really belongs in every doctor's office, in the world, because how different healthcare would be if, as healthcare providers, we were armed with this kind of information. It was never anything that I learned in my nursing program. I did take nutrition classes during nursing school, and I thought I was eating a pretty healthy diet at the time. And so I started making changes because it seemed like a really natural way for me to take care of myself at a time where I was actually in a big transition. And I ended up moving out to California, like around that time frame as well. And that was actually really helpful because it was, I had grown up on the East Coast, and so California has like this abundance of produce. So it was really easy to become a plant-based eater. And that's actually where I met Cyrus, and in California. And so when we met, I was already I had already become plant-based and vegan, and it was kind of a cool match that way.
That is so cool. I'm so
Yeah.
happy. Nice. You mentioned PCOS. That seems something that a lot of people suffer from. How can
Mhm.
improving their insulin sensitivity and adopting a plant-based diet help women not to develop that, or help them once they have it?
So PCOS is actually a really interesting condition for women because we sort of classify it almost as it's a condition that you're born with. So it's something that can be diagnosed over time, but it's something that women who are diagnosed with PCOS don't have that same prevention option that you would with like type 2 diabetes. So it kind of acts a little bit more and behaves a little bit more like an autoimmune type of diabetes. So we see it as a condition that is significantly influenced by your level of insulin resistance. So when you have PCOS, it does impact your hormone levels. It impacts your fertility. It impacts your overall. There's a lot of symptoms that come along with PCOS, including difficulty losing weight, or even some skin conditions like acne and things like that. So there's a lot of symptoms that go along with PCOS. Also, very painful cysts that can develop. And it can also cause dysregulated menstruation and menstrual cycles, as well as infertility. So there's a lot of reasons why PCOS is important to understand if it's something that you're living with. The way that insulin resistance kind of plays into this is that the more insulin resistant you are from your dietary and lifestyle choices, the more your PCOS is going to be affected. So, for example, a lot of women living with PCOS are challenged in fertility, and they actually are suffering with infertility. And one of the kind of gold standards for fertility is to have, to proceed with even pregnancy or fertility treatment, is to have an A1C less than 6.5. With PCOS, oftentimes women with PCOS are living with much higher A1C values, and it can be very challenging to bring those numbers down when you're following the standard dietary approach, which is a low carb approach. So a whole food, like our approach of low fat plant-based diet helps you to reverse the dietary contributions of insulin resistance so that you can move towards more healthy fertility cycles, getting your hormones into balance. I mean, it really, the insulin resistance sort of from your dietary choices or lifestyle choices is what influences your PCOS to sort of can worsen the symptoms of your PCOS.
Interesting. It's funny because I'm pretty much the exact same way as Robbie and Cyrus, I guess, and the rest of the people in Mastering Diabetes, whole food, plant-based, low fat. I don't eat sugar, oil, or salt. And I've had people now twice have taken my program, and one was in her 40s, one was in her 50s, and then they got pregnant. Like they had infertility for like 20, 30 years, and they had given up, and then they started eating this way, and they both got pregnant with healthy births. I think it's amazing. I think it gets overlooked a lot in infertility, the diet.
Absolutely. And, the diet is so anti-inflammatory. If you are living with something like PCOS or other conditions affecting your inflammation in your body, endometriosis is another one. An anti-inflammatory diet can be really, really powerful for improving your fertility outcomes. If you are living with any form of inflammation in your body, it's a really wonderful way to reduce the factors that you're potentially adding in that cause inflammation in your body.
Nice.
One thing that I did notice here when we were going through the fertility process and trying to, do everything we could to try and get Kylie pregnant, is that you see every single fertility specialist that you talk to, every single doctor you talk to, every single women's health specialist that you talk to, they all use one common word, which is inflammation, inflammation, inflammation. You see it everywhere. It's like, oh, well, your body's inflamed and that's why you're not getting pregnant. Oh, well, your body's inflamed and that's why you have endometriosis. Oh, your body's inflamed and that's why, you're, feeling low energy, right? And so if you really get to the root cause of the problem, you're like, okay, well, what is inflammation and what can I do to reverse that inflammation? Or what can I do to actually significantly, decrease the level of inflammation that's not only in my reproductive tract, but everywhere in my body. And one of the recommendations that you hear from people or from doctors is eliminate dairy. That's it. They'll basically say, oh, you're inflamed, so you should eliminate dairy. And you're like, well, I did that years ago. And then they're like, oh, okay, well, that's all I got for you. Right. And it's like, that's it. The whole conversation stops right there. Right. Because they know that an anti-inflammatory diet is synonymous with a low dairy intake or no dairy intake. Right. But as we're going through this process, I'm almost just like, man, I'm like, you got the right idea. Just go further and further and further. Say, okay, eliminate dairy, significantly reduce your animal product intake, dramatically increase your fiber intake, dramatically increase your low-fat, plant-based, whole food, fruits, vegetables, legumes, and whole grains. And, that's how you get to a truly anti-inflammatory state in your reproductive system and total body, right? The nice thing is that Kylie already has been doing that for 10 years, and that dramatically helped out in her process of overcoming endometriosis. But, until you really get to a true understanding of how to completely eliminate inflammation in your body, you'll never really get to a point where you fully understand how to eliminate many of the problems that, plague women's health.
That's why I don't understand why they're recommending these high fat, high meat diets, because they are inflammatory.
Mm-hmm. It's interesting. And as Cyrus mentioned, I discovered throughout our fertility journey that I was living with endometriosis and I had been misdiagnosed for many years. I didn't know that was what was the problem inside of my body. And interestingly, it had been there for many, many years. I did have surgery to remove the adhesions that I developed. And my surgeon was really curious because he said that it was very old tissue. It had been there for a very long time, and I hadn't developed a large amount of inflammation. Like, there wasn't a lot of new growth that they found, which is super different from most of the people that he sees. And he did comment that he felt that was from the diet and the lifestyle that we have been following for so many years. So, for me, kind of back to like when I first was adopting a plant-based diet, I always felt I had this. The only way I could describe it was inflamed. I had been diagnosed with things like IBS, and, I had what's called eczema, and just some like generalized inflammation in my body, but I couldn't quite put my finger on it, but I knew that there was something going on. And until I got the endometriosis diagnosis and really figured it out and got to the bottom of what was really causing pain and my infertility, for sure. I feel like I was drawn to the diet in a way to help minimize that level of inflammation in my body. And that was one of the draws that I had to it. But you're right, in the general world, plant-based nutrition is not recommended as part of the course of treatment. Nutrition in women's health is not discussed very often during pregnancy, it's just not a very well-developed topic at this point.
Not at all. Do most women that have endometriosis have infertility and or pain? Because you didn't seem to know that that's what you had.
Yeah, right. Yes. And actually cyclic pain, so menstrual cycle pain, is one of the key markers of endometriosis. Although some women don't have that. Sometimes it's low back pain, hip pain. For me, I just thought I wasn't doing enough yoga. I was like, well, maybe if I stretch my hamstrings a little more, this will go away. And it was very interesting to kind of look back once I finally was able to learn and understand more about it. Pain is so subjective, so a lot of times doctors are asking women about their pain around their cycle, and menstrual pain is not supposed to be incapacitating. It's not supposed to be making you miss work or activities. And so sometimes when somebody asks you, do you have pain? It's like, sure, but I don't know how to compare that, right? So, just as a PSA, menstrual pain is not normal, needs to be investigated. And oftentimes the cause of that is endometriosis. And 1 out of 10 women are actually living with endometriosis, and it goes undiagnosed or misdiagnosed for many, 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 many years. The average length of time it takes to get diagnosed with endometriosis is 10 years.
Oh my God. How did they finally diagnose you?
So we did see a fertility doctor finally, because we've been trying to conceive, and I actually had a large cyst on both. I had cysts on both of my ovaries, but the one was very large, and it was diagnosed as what's called an endometrioma. which is a stage 4 endometriosis. And it's a it's a cyst that's filled with blood from endometriosis tissue. And the endometriosis cells grow very rapidly, and they're very proliferative in the body. And so they spread all throughout the pelvic floor. So once you get so the only visible form of endometriosis on an ultrasound is endometrioma, which is a cyst in the ovary, a specific cyst. So when I heard that, I was like, well, wait a second, what does that mean? And they were sort of, at that point, it was like, well, you'll need to do fertility treatments. Well, I sort of took it to the next step, and I wanted to learn more and more about it. So I ended up, investigating, learning more about endometriosis, reading everything I could get my hands on about it. And again, as somebody who had been working in women's health for so many years prior to working with Mastering Diabetes, I was like, how did this happen? How did this get missed? But a lot of times it presents with bowel, bloating. A lot of women get misdiagnosed with IBS, which I was one of them. A lot of women get diagnosed with unexplained back pain, low back pain. There's a lot of pain and discomfort that comes with it. And, I have to say, I did take a course that took me down a path towards surgery to have the cysts removed. I had multiple adhesions that were actually restricting my ovaries and restricting some of the other areas of my pelvic wall and my pelvic floor. And I came out of surgery and felt better almost immediately. It was remarkable how different I was relieved of this tension in my back, tension in my legs. So my surgery, and then we were able to conceive 2 months later.
That's amazing. How long did you try to conceive before the diagnosis?
For 2.5 years.
That is incredible. 2.5 years, no luck. And then what's this?
Yeah.
2 months. That's amazing. Do they know what causes endometriosis? I believe Dr. Barnard maybe talks a little bit about it in his book, Body in Balance.
He does. And actually, I definitely recommend that book for women in general. When we're talking about women's health topics, his book is really wonderful. He does go into detail about a lot of these health conditions and how plant-based nutrition can really help support healthy functioning. But yes, so there's a couple different theories on endometriosis, the causes. One is exposure to different toxins, things like pesticides and plastics, chemicals in plastics. There's some theory that it is an autoimmune condition. It's still very poorly researched and known and understood at this point, unfortunately, which makes it really more difficult to diagnose. There's a wonderful book. If anybody's interested, it's called Beating Endo, written by an endometriosis specialist. And my pregnancy brain is catching up with me because her name is totally escaping me and I'm embarrassed. But anyway, it's called Beating Endo, and I'll think of the doctor's name. Anyway, she's an endo specialist in Santa Monica, and her book just describes so many of the symptoms of endometriosis. And one of the theories is that she sort of addresses this, that it could be autoimmune. So there's some sort of maybe autoimmune function that's happening. They also describe that they've done they've seen in sort of baby fetuses that they've done autopsies on. They'll actually see endometriosis tissue sometimes in the fetal tissue, which is interesting to think that it could be something that's you're coming into the world with, So it's not very well, it's still in the development of being researched. So
Kylie, it's Iris Orbuck.
Of course. Oh my goodness.
No worries.
Iris Orbuck, and she's wrote this wonderful book, Beating Endo. So
it's so interesting because I'm not going to be having a baby, but I had really horrible infertility. And when I think back, I got my period when I was 11, which is really early. And I had cramps from the first period. And I mean, the ones where you take opiates, they were so bad. And nobody ever, no doctor ever said, well, this isn't normal for, nobody was looking into that in the 70s, I probably may have had it too, but who knows? That's so interesting. I'm wondering, Kylie, when somebody has gestational diabetes, does that make them more susceptible to actual diabetes later on?
Absolutely. There's a clear correlation between diagnosis with gestational diabetes and developing type 2 diabetes in the future. And also for your baby as well. There's actually a correlation between babies born to moms with gestational diabetes and their development of type 2 diabetes in the future as well. So there's an absolute correlation. And so preventing, gestational diabetes and really taking that step back and looking at, well, what's the root cause here? How is insulin resistance showing up in your body? And that's one of the things that I work with women, to really investigate and get to the bottom of, like, where is insulin resistance showing up for you? What biomarkers are being affected? What types of, how can we help you reverse the insulin resistance and prevent the type 2 diabetes from coming out altogether, in the future?
Does it, if the mother has diabetes, does that make the baby more susceptible to having diabetes?
Yes, and there is a correlation between children born to moms with gestational and then their development of type 2 diabetes and other other chronic conditions in the future as well. And there's a whole world of interesting information on epigenetics and the condition of the uterus and the condition that a baby is thriving in. And when the situation with gestational diabetes is that it causes so glucose passes through the placenta. So when you're a pregnant woman and you're living with high blood glucose values, that glucose will pass over into the baby. But insulin that mom is making does not. So the baby basically gets on this high volume of glucose. And what happens is they start producing their own insulin. And insulin is actually a growth hormone. It acts as a growth hormone as well as it delivers glucose to the cells. So it's a really important hormone when you're a baby developing inside the uterus. And when babies are exposed to these high glucose concentrations, they're also exposed to their own self-produced insulin levels. And so they're often born with, there's sometimes, if mom's blood glucose is not controlled, babies can be born bigger than, like on a bigger size. They can be large for gestational age, which means that can lead to some birth complications. They can have difficulty breathing. It does affect lung development, affects their cardiovascular system. So, managing blood glucose during pregnancy becomes a really, really top priority. And, what I'm experiencing too, and I mentioned, like, the first glucose check that I've gotten was at 28 weeks. It was actually this week. And that means that all of those weeks leading up to this, if I had been somebody living with insulin resistance, I could have had a higher glucose reading and not known it. And this is really part of why, like you were mentioning before about like preventing it in the first, like learning about insulin resistance before pregnancy is so important, because you can really manage your blood glucose throughout pregnancy very easily using the tools in our method and eating a low-fat plant-based whole food diet. So that's something that we love to teach women and help women navigate either when they are diagnosed with gestational diabetes or when they're if they're trying to prevent it in a subsequent pregnancy.
So they can join the program at any time. They don't have to wait until the pregnancy is over.
No, absolutely. You can join anytime. And so now we've created a special program just for women who are pregnant. And
that's great.
Yeah, which is awesome because, one of the influences that creates more insulin resistance during pregnancy is the onset of progesterone. So progesterone is a hormone that actually causes more insulin resistance. So if you're somebody who's already insulin resistant prior to pregnancy from your diet or lifestyle, then you have progesterone levels that are rising. That predisposes you to more insulin resistance, which causes more blood glucose variability and causes higher glucose values. So when we're in our pregnancy group, the idea is that we're supporting, it's like a community of women kind of going through the same situation, trying to navigate and kind of responding quickly. Our when we work with people who are not pregnant, we take our time working through the program. We don't expect people to make changes overnight. Lifestyle changes take time, as you probably are well aware. It's a constant refinement of making changes and seeing what works and seeing how you can build habits. When it comes to gestational diabetes, it's a little bit more, we kind of got to jump right into it because we want to get those blood glucose values down. So, using our tools really quickly and together, especially making dietary changes very quickly becomes a really important strategy. And it's nice to know that you have a community of people around that are taking the same steps that you're taking.
Nice. So I'm going to get to some of the questions in the chat now for you. And the first one I see is from Jessica. And she says, what is a good way for a plant-based kid to get calcium if they only want to eat baby spinach?
Oh, only want to eat baby spinach. Oh boy. So no broccoli, no beans. I would say beans would be a good place to get some calcium in there too. When you eat a variety of whole foods, you're going to get small amounts of calcium along the way. So micronutrients are not isolated to one particular food, which is helpful, right? So the best thing that you can do for your child or for yourself is to log your food. Using a tool, we recommend a tool called Chronometer, and we love it because you get a really great, you can see really clearly all of the macro and micronutrients you're getting throughout the day. So most people, when you're actually getting a variety of foods into your diet, will find that you're getting little bits of these micronutrients, right? Like minerals and vitamins throughout the day. And that overall, he may actually be getting more calcium than you realize. So I would start with some food logging to see how much he's actually getting. And then also, there are some nutrients that are important to supplement, and there are some nutrients that growing children especially do require for supplementing. And so, there's certain supplements out there that are complete supplements that can be really supportive. I would definitely talk with your child's pediatrician. And actually, there's a new book written called Nourish, and it was written by, again, forgetting doctor's name here.
Brenda Davis and Reshma Shah.
It was Brenda, yeah, exactly. So I knew Brenda, I forgot the pediatrician's name, but it's written by a Stanford pediatrician and Brenda Davis, who's a registered dietitian. And I use that book. It's a wonderful reference. It's a great resource for children, introducing plant-based nutrition to children, and also finding ways of strategizing how you're going to get those nutrients into your kids. The other book is one of Brenda Davis's book called Becoming Vegan, which I recommend that one because it goes through the life cycle. Basically, it takes you through the life cycle, and she explains what types of nutrients you need at every stage of your life, including infancy, toddler, childhood. And it's a really great reference book with lots of great suggestions and things like that for plant-based parenting.
Great, thank you. And Louise wants to know, do you work with people with osteoporosis? Is there hope through diet for people with osteoporosis?
Yes, absolutely. And it's interesting. We work with women throughout the lifespan. So yes, I've seen women who have come to us with osteoporosis or even osteopenia, beginning stages of osteoporosis, and their bone scans, we've seen bone scans improve over time. And one of the things about, as we're aging and as our bones are aging, one of the best things you can do to actually help your bone health is actually exercise and resistance exercise. Food is important, and certainly your nutrients are very important, and they come along for the ride when you're eating green light foods that we recommend, all of the wonderful foods that Chef AJ talks about. And we have, but when you look at, just like your muscles and all the tissues in your body need exercise, so do your bones. And your bone health is actually strengthened when you're performing regular exercise. So that's something to consider if you are living with osteoporosis, finding somebody that you can work with to help start building some resistance exercises, whether it's swimming in a pool or bike riding, or things that you don't have to necessarily use weights for. Weight training can be supportive, but if that's not available to you, maybe work with a trainer, because exercise is a really, really important, and specifically weight bearing or resistance exercise is really important for osteoporosis and bone health in general. But we've absolutely seen women who have had improved bone scans from when they've adopted this approach.
That's fantastic. Okay, so here's a question from Daphne. How does it help with menopause?
Whole food nutrition with menopause. I'm so glad Daphne asked that question because it's another topic that it's interesting, you know, as somebody, I've been a nurse, you know, working with women for many years. And one of the things that I hear a lot from women is, you know, during menopause, there's a lot of, you know, things that are happening to me that I can't control, right? Things that are happening that like I can't lose weight in menopause. I can't, like, I've heard this time and time again. And one of the really cool things is that we work with women, like I said, through the lifespan. So we see many women who are going through menopause and have actually seen improvements in their menopause symptoms. And there's actually quite a bit of research out there on this topic, because one of the things about menopause is that your estrogen levels start to decline, and that's where menopause starts to kick in. And that's what brings on some of the symptoms of menopause. As estrogen levels decrease, your level of insulin resistance actually goes up. So lower levels of estrogen increases your insulin resistance. So if you're, again, kind of like during pregnancy, when your progesterone levels are rising, if you're already living with some form of insulin resistance and you're living with a lifestyle or dietary insulin resistance, and then on top of it, your estrogen levels start to drop, you actually can see higher insulin resistance. It can become harder to lose weight. It can be harder to, you can actually start to see your cholesterol levels increase during menopause. So a lot of these biomarkers for insulin resistance are affected during that drop in estrogen. And so by eating a low-fat plant-based diet and reversing your dietary cause of insulin resistance, you actually gain so much more control of your menopause. And women tell us all the time their, you know, symptoms, their hot flashes decrease. They have more energy. They're not as tired. They're feeling, they're able to lose weight during menopause. And that's a big thing. Like, a lot of women feel it. I can't lose weight. I can't lose weight. I hear this from women in their, you know, late 40s through 60 and that time of perimenopause. And we see women losing weight consistently and keeping their weight off. And so one of the things about our program that we really love promoting is the fact that we're teaching you tools to build a lifestyle that help to empower you at any stage of your life, and whenever, you know, if there's things that are going on inside your body that you can't necessarily control, you can still take charge and you can still take action for your best long-term health outcomes. And so it's really exciting.
That's fantastic. Carmela says, Kylie, love her. That's fantastic. I'm looking for some more questions. Yeah, we answered that one. She did have trouble getting pregnant, 2.5 years, 2 months after that. Here's one from Amy. Can Cyrus or Kylie discuss gestational diabetes and the minimum amount of fat a pregnant woman needs? I've used the Mastering Diabetes plan from the book since diagnosed with GD at week 22 of pregnancy. How much fat should I be eating for the health and proper development of my baby?
Mm-hmm. Yeah, great question, Amy. And so the current recommendations for total fat during pregnancy from American College of Obstetricians and Gynecology and other organizations that make these dietary recommendations during pregnancy are somewhere between 20% and 40% of your dietary intake from fat. So that's a big range. And so we, you know, when I'm working with my pregnant women, we usually aim for 20% to stay within that range. And it's easy to do that when you're eating a green light diet. Sometimes we add in some additional of our yellow light foods. So that's our recommendation, because it does fall within those guidelines of the sort of recommended dietary guidelines for pregnancy. And, you know, pregnancy is a really tricky time because there's not a lot of, the research during pregnancy is very limited on nutrition, because it's not easy to do studies on pregnant women. You have to do retrospective studies, and it's very difficult to cohort women to plant-based eaters, low-fat plant-based eaters, that sort of thing, right? So it's challenging to get good nutrition data on women during pregnancy. So, but what they do have some really good studies on is fiber in pregnancy. and the fiber intake. And when they show that women who eat high volumes of fiber during pregnancy have 33% reduction in things like preeclampsia, 30 to 35% reduction in gestational diabetes. So one of the things to really focus on in your diet is really getting your fiber intake up as much as possible. And 50, 75, 80, 100 grams per day, like there's no limit on fiber. So, you know, while we do focus on macronutrients in mastering diabetes, and, you know, for our non-pregnant population, we recommend staying under 15% of your total calories from fat. When you're pregnant, 20% is a safe recommendation.
Nice. We have a very nice comment from somebody watching named Daryl, who's actually a retired doctor. Gotta find it. I want to read it to you. It's very nice. She knows more about this than most doctors, and more important, she cares. That's very nice. Thank you so
Thanks,
much
Daryl.
for watching, Daryl. Let's see if we have any more comments. Maybe while I'm looking for more comments and questions, what have you had any weird cravings, or what kind of things have you been eating through your pregnancy? Have you had morning sickness?
No, and actually, I have to tell you, that's something Dr. Barnard has actually written about that, about pregnancy and plant-based nutrition, that women who are plant-based eaters, or they've done studies with like vegetarian diets, people who have no meat in their diet actually have less morning sickness. I breezed through my first trimester. It was really comfortable. I did not have any morning sickness. I did not have any nausea. Sorry, that's not true. I had a little bit of nausea in the evenings. My cravings have been funny, lots of fruit, and I'm not usually the sweet tooth person. Cyrus is the sweet tooth person. I'm usually like more the savory. I love potatoes. I have barely craved a potato. I thought I would be like making potatoes by the pound, you know, while I was pregnant. I've had them a few times. They've been good, but like not, I was surprised at that. I've been craving a lot of citrus, lots and lots of citrus, which is pretty common during pregnancy actually, but lots of fruit. I eat, I mean, our days are filled with eating a lot of fruit anyway, but I almost like can't get enough like apples and citrus fruits. And now that it's like summertime here, we're getting so much beautiful produce that I'm like just filling the refrigerator with berries and peaches. And so I'm loving all of that.
That's
Lots
so
of
cool.
fiber.
Are you gaining the right amount of weight for where you need to be?
So yeah, I'm at perfect weight gain right now. Actually, I just saw my midwife this week and I've gained 21 pounds so far. I'm 28 weeks, and the recommendation would be for me to gain between 30 and 40 based on my pre-pregnancy weight. And I'm on target for that. And, you know, I do a lot of food logging, and I watch my intake of things like protein, because during second and third trimester, your protein needs do increase. And when you're logging your food, the beauty is that I can see exactly how many grams of protein I'm getting every day. When I'm showing, you know, I can show my team how much I'm getting. So baby is growing perfectly. And I actually just had my oral glucose tolerance test this week, and I did pass it. I do not have gestational diabetes. So that was exciting. And so kind of like little markers here along the way. Everything about this pregnancy has been very healthy. I'm super energized. I feel amazing. And, you know, I'm super excited to be able to see the effects of my lifestyle on my pregnancy.
Nice. You know what I don't get? This might sound like a stupid question, but I've never had a baby and I'm not a doctor. But babies generally weigh like 7, 8, 9 pounds, and women gain like, what is that other weight? What is it?
It's crazy. It's a great question. So part of it is amniotic fluid. So the baby's surrounded by all this fluid that they're floating around in. And so amniotic fluid builds up over the pregnancy. And right now at my point of pregnancy and entering my third trimester, kind of maxed out at my amniotic fluid. There's not going to be a whole lot more volume of that up until the end. So that's kind of top weight on that. In that area. The uterus expands, and that is an organ that's growing. So there's some weight there. There's a couple, maybe 1 to 2 pounds just from the uterus expanding. The placenta, which is the organ that I'm currently growing to nourish the baby, which is attached to the uterus, that placenta weighs somewhere between 2 to 4 pounds. And then just general blood volume increase, because you know, it's interesting. I'm noticing things like I get winded really quickly, or like I'll run up my steps and I'm like out of breath right away. And I'm like, well, that's interesting. And that's because there's an increase in blood volume overall to help deliver blood flow to the baby. And that actually accounts for up to 4 to 5 pounds. So, it's a combination of things. Also, women's bodies are designed to store additional fat in other places. So
Yeah, tell me about it.
yeah. During pregnancy, especially, so that the baby has some stores of energy. So, for example, breast tissue, a lot of women store a little extra fat in their legs. There's places where you're storing extra energy because towards the end of pregnancy, so like you store up a little bit at this point in pregnancy because towards the end, the baby's going to start growing by 0.5 pound a week, starting probably around 32 weeks. And so right now the baby's about 2.25 pounds. So, I would like to see a baby that's, closer to the 7 pound mark, but that's going to take a lot of growing. So in the end, a lot of the weight comes from the baby's growth. So, but yeah, I'm pretty much on target right now to meet the healthy weight expectations for somebody in my size. And, the other thing about pregnancy weight gain is that women who are, either at their ideal weight prior to pregnancy or a little underweight prior to pregnancy do require a little bit more weight gain, usually somewhere between 25 to 40 pounds. Women who are overweight before pregnancy don't require as much weight. They don't have to gain as much weight because they have a little extra nourishment already. There's reserves there for the baby to draw from and for their body to draw from. So, healthy weight gain during pregnancy is important to focus on. But a lot of women, even if you do have excess weight prior to pregnancy, it's actually very safe to lose weight even in the first trimester during pregnancy. So that's something to consider if you're concerned about developing gestational diabetes. That first trimester is still a great opportunity to still work towards some of your health goals.
Nice. A lot of people are asking if you know if the baby's a boy or a girl yet, if you've decided to find out.
We have decided to wait for this baby to surprise us.
Well, people are saying it's going to be a brilliant baby. It's your and Cyrus's baby. So that's pretty cool. I just have a crazy idea. When you go into labor, why don't we just go live and just
that would be amazing.
And broadcast it. Wouldn't
film it all. Yeah, you can watch the whole thing unfold. That would be great.
It might be kind of a fun idea. I don't know if anybody's ever done that on YouTube. All right.
Well, we'll talk about that for sure. I mean, I'm definitely very open to sharing this experience.
That'd be cool. If I'm home at that moment, let's just do it. It's like, I think it'd be amazing. I think it would be like, we'll just keep it open the whole time, Oh, people are saying that would be amazing. Hey, I'm open if you guys are.
Oh my gosh. The baby is due on September 16th. That's our official due
date. But me and Cyrus were asking you to wait till the 22nd so you'd have a Libra instead.
I know. That's yes. And there's a full moon on the 20th. So maybe that will increase the labor process and then I can wait for my Libra baby.
But there was a restaurant, or probably still is a restaurant on Tahunga in Studio City and they swear that they had this salad that when women weren't going into labor because they were overdue, that if they ate this salad, it was a vegan salad, they would all go into labor.
Were there dates on it?
I don't know. I have to look it up. But, I thought it was an urban legend, but then you look at it and apparently you go to this restaurant, you eat this salad and
oh my gosh.
I gotta look that up and see if it's still there. In your case, we want to delay it just a few days. Yeah. Not that there's anything wrong with Virgos. We love Virgos. Dr. Doug Lyle is a Virgo. So
is he? Oh yes, of course. Virgos are, and actually I have to say this baby has definitely read the baby book. Like all the things that they say are going to happen in pregnancy have been on point. And I'm pretty sure that's a very Virgo quality. On time, ready to go, read the book.
Tisha says, what does your bunny necklace mean and where can I get one?
Oh, it's actually a pineapple. I'm sorry. It's a pineapple necklace, this one. And actually a pineapple is actually a symbol of fertility, and it's actually a symbol within the infertility community of support. And because pineapples are actually a food that are actually shown to help improve fertility. And so it's actually a symbol of, that's what it symbolizes. And the company's name is, Coco, C-O-C-O.
Nice.
Sorry.
So you answered the question about how much fat was needed in pregnancy. And Susan says, is there a minimum amount of fat that plant-based vegans absolutely need? A number we shouldn't go below?
Yeah, a healthy kind of strategy for looking at total fat is we recommend a minimum of like 10% of your total calories from fat. And when you eat from the green light list that we recommend of green light foods, you're automatically going to meet that because all of these foods, again, have smaller amounts of fat in them. But when you start to tap into the yellow light list, that's where you can start to edge up above the 10% range. You get into the closer to 15%. People who eat less than 15% of total calories from fat tend to have the best results with reversing their insulin resistance. So we kind of aim for that sweet spot when people are logging their food. So food logging is a really important part of our program because we want you to see exactly where your nutrients are coming from, the macronutrients and the micronutrients. So we encourage this of all of our clients and people who are following our method. When you're eating green light foods, it's amazing to see how the fat and protein just follow along. So it just comes with the plant. So you end up with like somewhere between 70 to 80% of carbohydrate, around 10 to maybe 12% fat, and usually, the remainder is protein. And protein and fat actually travel together as well, which is super interesting. Also, really interesting, I've done this calculation a lot. Fiber and total grams of protein also tend to be almost identical to each other. Grams of fiber and grams of protein. So if you're looking at your total grams of protein per day, you might be surprised to see that your total grams of fiber are very similar to that number. It's fascinating when we look at recipes and food logging. So
Nice. Amber says, how do we get iodine in?
iodine. Well, you can get that from sea vegetables is one source if you're going to eat them, if you're going to eat iodine. Sea vegetables like sea kelp or kelp flakes or like nori paper, if you're using that to prepare your foods. That's one source of iodine. Some people also choose to supplement with iodine. That's another way to make sure you're getting adequate amounts. And again, during pregnancy, a lot of prenatal vitamins do contain some of those micronutrients already naturally. So, if you are in a pregnancy state and you'd like to look at your prenatal vitamins to see if you're getting those nutrients, it's really important. It's also helpful to work with a plant-based doctor who can help you understand where your nutrients are coming from. And maybe if you do need supplementation, they can monitor and also recommend supplementation if you do need that.
Great, thank you. Let's see, I saw a question. Where did it go? Oh, okay. Well, if you want to know the answer to that, Angela, read this book, but Kylie will tell you what are green light and what are yellow light foods.
Oh, okay. Got it. Yes. So green light foods are any fruits, vegetables, legumes, whole grains, spices, herbs, things like that, and mushrooms in the green light category. And they are to be eaten in abundance. The yellow light category, the reason that we call these foods yellow light is that they're slightly higher in fat, which makes them higher in calorie density. It also makes them, and they're also sometimes slightly more refined. So for example, things like plant-based higher fat foods like avocado, coconut, nuts, seeds, they're in our yellow light category. And then also foods that are sprouted, like sprouted grains, sprouted breads, things that are a little bit more refined, maybe like your, they have like bean pastas, things like that, where it's a whole food source, but it's been slightly adjusted. And when it comes to blood glucose management, which is something we focus on a lot in our program, when you add more yellow light foods, what tends to happen is people have slightly more blood glucose variability when you're eating those specific foods, the yellow light foods. So we recommend minimizing them to somewhere between maybe 1 to 3 times per week. But the funny thing is that sometimes a yellow light food can be a green light food, and sometimes a yellow light food can be a red light food for some people. It just depends on your level of insulin resistance. I've had many clients who, they eat that sprouted bread, or they'll have the bean pasta, and because their insulin resistance is so high, their blood glucose goes really, really high. Same with like eating an avocado. And then I have other clients who can eat those foods and they're just fine. But it is good to be aware of where those added calories are coming from, if that's something you're working towards, or also where the blood glucose contributors are coming from.
Great. Thank you. I know I saw a question from Ronnie. Where did it go? About, why does this move so fast? Oh, here it is. My grandson, 6 years old, vegetarian, but doesn't eat his veggies like he used to. Just worried. He used to like his broccoli and green beans, but now only likes dry beans. I'm assuming the beans are cooked though. Not gaining weight.
Okay. I'm curious how much, if he likes fruit. That's my like follow-up question. A lot of times kids really have like a really nice sweet tooth, and fruit is such a wonderful addition to a kid's diet. Fruit has so many minerals and vitamins and really good carbohydrate calories that can be a really great way to add in extra nutrients and easily, especially if you can maybe even sneak things into his like a smoothie or something. You can make fruit smoothies and then add greens in, add some other vegetables in. You can even, sometimes people will sneak in like broccoli into smoothies. There's actually, there's somebody that I like to follow. His name's Corey Warren. He goes by the Lean Green Dad, and he and his family have this blog and website, and they do so much in terms of plant-based meal planning for families to help integrate different foods in a way that's fun and interesting, and also delicious, that kids will want to eat. So sometimes it's a matter of like sneaking them in, or for example, like if you're making like a bean burger, maybe adding some like veggies into it. So that way he thinks he's getting a bean burger, and like here you've mashed up some vegetables like carrots and kale, and you know, there's lots of vegetables you can sneak. Beets are another good thing you can sneak into burgers. So you may have to get a little creative rather than putting the vegetables on his plate. And then also in terms of calorie density, adding fruit where you can, and sneaking in smoothies, and even for like throughout the day, if he wants a smoothie before bed and he's going to get extra calories in at night, you know, find out what he really loves eating and let him eat as much of those types of things that he wants to.
It's so important. I had Dr. Nicole Avina on, who wrote some books about what to eat to get pregnant and feed your baby. And she said it's just so important to just keep offering those vegetables when they're young, because then they'll develop a taste for them when they're older.
Definitely. Yeah.
So here's an endometriosis question. Jay is saying, for endometriosis, the common treatment is adding the pill to stop a period, which it also didn't do. Is adding extraneous hormones when you're having a diet to help with hormone levels harmful?
Adding hormones. Well, it depends on if you're having a hormonal imbalance. You know, one of the things that I think about when I'm working with my clients and when I think about my own health is what needs to be regulated. And yes, the birth control pill and hormonal birth control has been a treatment for endometriosis. It's been a standard treatment for endometriosis. The truth is that it doesn't work. It's not a treatment that actually, and I would refer you back to that book, Beating Endo, to get some really good information about endometriosis, because they talk about different types of treatment options and the treatments that do and do not work for that particular condition. You know, there is a time and a place for hormone replacement, and usually it has to do with when you're having an imbalance in your hormones. And some women choose to take hormone replacement during menopause to help with some of those symptoms as well. But there's, you know, when it comes to specifically endometriosis, I would say it's not necessarily going to be harmful to be on birth control, but if it's not a treatment you want to undergo and it's not helping with your symptoms, it's not helping with your endometriosis symptoms, I would get a second opinion and definitely look into some excision experts around endometriosis if that's something that you're living with right now.
Are there any plant-based doctors that you know that really specialize in this?
Well, so Dr. Orbach's book, she talks about an anti-inflammatory diet, and she does talk about reducing animal proteins and products and dairy. And she does talk about increasing fruits and vegetables and things like that. So no, so to answer your question, no, I don't know of any that are plant-based specific. And I think there's a great opportunity for this. Dr. Barnard talks about it in his book. And he actually recommends, his recommendations for endometriosis are low fat, same as mastering diabetes, basically. And it's interesting because when I first was sort of uncovering all this, Dr. Barnard's book kind of had come out a few months after I was diagnosed. And I read the book and I basically was like, well, I'm pretty much following this already, but I was able to make a few modifications with the time we were living in Costa Rica. So I lost the avocados, took them out. And to be honest, the other thing that was really helpful for me was acupuncture. I did see an acupuncturist regularly, and that was helpful in symptom management and in cycle regulation. There's a lot of research about acupuncture and fertility outcomes and cycle management, cycle regulation. So that was really helpful from a symptom point of view for me. But Dr. Barnard's book would be really helpful for you too.
Right. Dr. Barnard's book is a great book, and New York Times Selling Mastering Diabetes is a great book as well. Well, you are really good. It just must be so great working with you. You're so knowledgeable and so passionate.
Thank you. Thank you so much. I love what I'm doing. I mean, when I look back over my career working in neonatal intensive care, taking care of these little preemie babies for so many years, and working with families and women specifically after they've had their babies, we did focus a lot on nutrition, but I never thought I never really knew where my career was going to take me. And this opportunity to work with Mastering Diabetes and be a coach has been so inspirational for me as a nurse, as a healthcare provider. I'm so grateful for the opportunity to be a part of people's journey towards plant-based nutrition. It's been such a whirlwind of, an experience. And I love what I'm doing. So I'm really grateful, and I'm super excited to be able to share some of this with you today. So.
Well, Sherry says, so excited for Kylie and Cyrus. They will be the best parents. And Cyrus really hit the jackpot with you,
Oh my gosh.
And I don't know if you saw his interview Monday, but I asked him, because I know he used to be a fruitarian or a raw foodist. And I said, well, what made you eat cooked food? And he goes, because I want to eat with my wife.
Oh, that was so sweet.
I know. I mean, so it was really, really touching.
Thank you.
You're the best decision he ever made. Well, like, the invitation's open. And when that kid pops out, it could be like my youngest guest ever.
Your youngest plant-based guest.
Yeah. Do you have names, even though you don't know do you have names picked out for both?
Yeah, we have a list. Cyrus has a boy name that he really likes, and I have a girl name that I really like, and we're kind of like back and forth with a couple others in between. So I spent a lot of time in labor and delivery, and I can't tell you how many times babies would come out and the parents they thought they knew the baby's name, and they saw the baby. They're like, nope, that's not the name. This is the name. And so we kind of have some ideas, but I feel like this baby's going to guide us on that decision.
Well, Kambata is such a long name. I feel like maybe like a shorter name, just as Kambata. Like, how about Hakuna Kambata?
Hakuna Kambata.
Hakuna could be a boy or a girl. Hakuna Kambata. I love that.
Oh my gosh, that would be amazing. That would be awesome.
I don't know what Hakuna means, but it feels like it could be a Hakuna Kambata. I think of Hakuna Matata. Hakuna Kambata.
Yeah. That's so cute. Oh my gosh, we're going to add that to the short list.
Well, maybe that could be the kid's nickname. Well, I can't wait. Now, this has been so much fun, Kylie. Thank you so much. Gosh, I don't want diabetes, but if I did, I sure would want to work with you for managing it.
Thank you so much. And thank you for having us this week. And if anybody's interested, we do have personalized coaching available. We have a wonderful team of coaches. In part of my role is to actually train our new coaches and bring them, into our world and help them grow and develop. And we have an amazing team, and we love helping people on this journey. So
yeah, I could tell. You could tell you're the real deal. Pot's legit, they say. Oh my God, I meant to type you're a real beauty, and I typed beady. Sorry about that.
Oh, that's okay.
I cannot see without my glasses. I'm going to have to stop being so vain. And tomorrow we have another wonderful coach from Mastering Diabetes. We have Wendy Sullivan, and she's going to be making easy breakfasts and lunches. So I can't wait for day 5 of Mastering Diabetes week. So we have 3 more days. Thanks so much, Kylie.
Thank you, Chef AJ. Thank you so much.
Oh, it is my pleasure. And thanks all of you for watching another episode of Chef AJ Live. Come back tomorrow for day 5 Mastering Diabetes, where we are going to have a cooking demo. Take care, everyone.